Hi, my name's Emma and I'm one of the community midwives from Ashford and St Peter's Hospital. I'm going to talk to you today about writing your birth plan. Your birth plan or your birth preferences is basically a way of recording what you want for your labour and the delivery of your baby. You don't have to have one, but it's a good idea to just think about the things that you may want for your baby's delivery. Your birth plan will be discussed with your midwife at around 34 to 36 weeks in your pregnancy. This is the opportunity to let her know what your desires are for your birth and to discuss them in detail and ask any questions. It's a good idea to talk to your partner about what your preferences for your birth are, because in the instance that you're having a contraction and you're not in a position to talk freely with your midwife, your partner is able to have this discussion with them on your behalf. There are lots of uncertainties with birth, so it's a good idea to know what your options are and what is available to you. Sometimes things don't go to plan. I'm going to talk to you now about where you would like to have your baby, your birth choices. For most people who have an uncomplicated pregnancy, they will follow the pathway of care where you would deliver your baby at the birth centre. Some people may even wish to deliver their babies at home. This discussion will take place in your pregnancy with your midwife, and she will arrange a home visit with you at 36 weeks. During your pregnancy, once you reach 34 weeks, we'll assess whether you're still low risk in pregnancy, and if that is the case, you'll be able to have your baby at the birth centre. If anything out of the ordinary has happened in your pregnancy, we would make a one-to-one assessment with you to make a decision about what is safest for you and your baby. If you feel that the low risk option is not what you want and you would like to have an epidural in labour, then you can have your baby up on the labour ward. Most people go into labour naturally by 42 weeks in pregnancy. And usually if you've had an uncomplicated pregnancy, then your midwife will offer you a membrane sweep at around 41 weeks. After this, you will be offered an induction of labour, which will take place either in the antenatal clinic or on our antenatal ward. At St Peter's, there are a number of methods that we will likely use. You will have an assessment by a midwife and a decision will be made along with yourselves as to what is the best method to induce your labour. This may start with Propess, which is a prostaglandin which is inserted into the vagina that looks a little bit like a tampon. This will stay in for a period of 24 hours. An alternative to the Propess, or as a second line, we may use prostaglandin gel. If you are not suitable for a prostaglandin, then you may be offered a balloon induction instead. There's a number of other reasons that we might offer you an induction. If you are having a multiple pregnancy, so twins or more babies, you'll be offered induction earlier. If you have gestational diabetes, if your waters have been broken for longer than 24 hours, or if there's any concerns about your baby's growth. Anytime you are offered an induction, this will be discussed in detail either with your midwife or your consultant. Other things to consider for your birth plan. Everybody is completely different, so your birth plan is personalised to you. So if there is anything at all that you specifically want for your labour, then it's a good idea to make a note of it. Things that we want to know about are your preferences in regards to the third stage of labour, which has been discussed in another video. We also want to know how you feel about your baby having vitamin K. This is offered to your baby at birth, either orally or via an intramuscular injection into the leg. It's important that you let your midwife know how you plan to feed your baby, whether you want support with breastfeeding or whether you're going to bottle feed your baby. If you are planning to bottle feed your baby, then we recommend that you bring in pre-made formula milk for your baby. If you have any questions at all about your birth plan or your birth preferences or any questions that you'd like to ask, please direct these to your midwife at your next appointment.